Would a couple come in to see you when they're having trouble having a baby, or would it be the woman who comes in to see you? How does that work?
It could be both.
Yeah.
Most often in my practice, the woman comes in first. And I think we should probably work on changing that a little bit, because it takes two to make a baby. But I think often it's the woman first who might intuitively feel that there's something wrong, right? So maybe they've been trying to conceive for 6 months to a year, and it's not happening. And so the woman might feel inherently that something is wrong and just want to come in and talk about that. Now, a lot of women fertility specific come in to see me because they already know there's potentially a problem, because they've been to a fertility clinic or specialist. They maybe have been worked up at that point, which is really stressful in and of itself. And so I'm helping to explain not only what they've learned to that point about why they're having difficulty, but I think what I really emphasize with both men and women is that we have to look at fertility as really something that depends on your overall state of health, and we can't forget those basics, right? And so even that level of stress that's driven by the whole fertility process is huge. If you feel you don't understand what's going on, or what people are telling you is going on with your body and why it's not working, that is a huge piece of stress. And that in itself can be a barrier for people. So I help to break that down, focus on just nourishing to people, getting you back to your really good place of health, because that'll help you conceive but also have a healthy pregnancy, grow a healthy baby, and it translates in so many ways. So
how else would you help someone that might be different than what they would be getting from a fertility clinic or conventional doctor?
So if people are undergoing treatment through one of those centers because of an actual diagnosed condition, maybe endometriosis, maybe low progesterone, or like an identifiable issue, it's not my job to interfere with that treatment, but to do things that are supportive, allow that to do its job, but really help to, once again, just optimize the health of the body and the things that make fertility happen, right? And so that might look a little different for men and women, but there's basic things that you do nutritionally, basic supplements, stress management, diet, all that kind of stuff. And it's about building a plan, if they already have that treatment piece going on or not. Naturopathically, there are herbs and key nutrients and things that have evidence behind them to show they achieve a certain, shift in a hormonal system, or effects on egg quality or on sperm motility, things like that. But it really just depends on the couple. So it's really, really highly individualized, and it has to be driven by a good assessment, a good understanding of the people, and then build from there. Yeah.
What has been your experience? Because I know this is one of your specialties, is helping people with fertility issues. Can you often help people and get them pregnant?
Yeah, it makes me really happy to talk about it, because I would say, in my experience, the clients that have successfully conceived sort of while we've been working together, I've been able to see them right through their pregnancy and then meet their kids, and I can't think of anything better. It's amazing.
It is amazing.
I have a client right now who went through 2 rounds of IVF before we started working together. That's in vitro fertilization. No successful pregnancies, and we did acupuncture and some nutritional supplementation, really just help prepare her body for the next cycle. It was kind of like her last kick at the can, because that's an expensive process. And it was successful, and she's now 22 weeks pregnant.
Wow, that's amazing. Yeah.
Which was really great, and that was the first for me. I've never seen someone through an IVF process like that. So. And
that is really expensive. So ideally, I bet you'd love it if someone came to you before, so you had time to prepare them for it, right? And make sure they're ready to accept.
Yeah, I always remind people, when we're looking at fertility, things don't happen overnight, and you have to consider too, if we're looking at improving the health of the egg and the sperm and the other factors that have to be there to make it happen, the actual life cycle of those things is like 3 months, right? So often I set people up to think about, if you're thinking about conceiving, give yourself 3 to 6 months to just work on your health, right? And that's what I'm here to help you do. And then when you get to that place and you successfully conceive, you'll have a better pregnancy. The whole process will just be as healthy as possible.
Yeah.